Welcome back to our channel. In this video, we're discussing self-management and home cares after cardiac catheterization, so stay with us till the end. So, what should patients who have undergone cardiac catheterization keep in mind?
Great question. First off, once the NPO caution's duration has ended, it's important to encourage adequate intake of oral fluids. This helps to eliminate the contrast agent and prevent nephrotoxicity. Ideally, urinary exhaustion should be maintained within a range greater than 30 ml per hour. Patients who have undergone this procedure are prone to bleeding, vascular damage, and lack of adequate blood supply. Therefore, they should be monitored for bleeding. If bleeding occurs, pressure should be applied to the catheter insertion site, and the patient should be referred to treatment centers for laboratory examination, drug therapy, and invasive measures. The patient should also be examined for thrombosis. In case of a hematoma, in addition to pressure dressing, manual pressure should be used. To prevent infection, the dressing should be kept dry and clean. When changing dressings, all sterile principles should be followed. This includes wearing a mask, sterile gloves, and washing hands before and after changing dressings. The femoral vein is most likely to become infected, and the subclavian vein to the medial jugular vein is the least likely to develop infection. For this reason, the patient should not use the pool until the wound is completely healed. The dressing should be removed after up to 24 hours. In these patients, the body temperature should be checked to prevent bleeding and to be aware of the occurrence of infection. Vital signs including heart rate, blood pressure, respiratory rate should be checked. Tachycardia with hypotension indicates bleeding unless otherwise indicated.
That's really insightful. What about after discharge from hospital?
After discharge, patients should follow these guidelines for self-care. Number 1. If the artery in your arm or wrist was used, avoid lifting anything heavier than 5 pounds and avoid repetitive movement of your affected hand and wrist for the next 48 hours. Number 2. If the artery in your groin was used, do not bend at the waist, strain, or lift heavy objects for the next 24 hours. Number 3. Do not submerge the puncture site in water. Avoid top bath, but shower as desired. Number 4. Talk with your primary provider about when you may return to work, drive, or resume strenuous activities. Number 5. If bleeding occurs, sit or lie down and apply firm pressure into the puncture site for 10 minutes. Notify your primary provider as soon as possible and follow instructions. If there is a large amount of bleeding, call 911 and do not drive to the hospital. Number 6. Call your primary provider if any of the following occur: swelling, new bruising, or pain from your procedure puncture site, temperature of 101 Fahrenheit degree or more. Number 7. If test results show that you have coronary artery disease, talk with your primary provider about options for treatment, including cardiac rehabilitation programs in your community. Number 8. Talk with your primary provider about lifestyle changes to reduce your risk for further or future heart problems, such as quitting smoking, lowering your cholesterol level, initiating dietary changes, beginning an exercise program, or losing weight. Number 9, and last one, is your primary provider may prescribe one or more new medications depending on your risk factors. Take all of your medications as instructed. If you feel that any of them are causing side effects, call your primary provider immediately.
Thank you for sharing these valuable tips. We hope this information helps our viewers who have undergone cardiac catheterization or are caring for someone who has. Stay tuned for more health tips on our channel.